My name is Jacqueline, and we'll be going over Expedited Partner Therapy, specifically a manual for Hawaii health professionals. This is the agenda we'll be going over. I'll also have some parts of the manual available throughout the presentation. So first off is purpose. EPT is an alternative practice providing immediate treatment and accessible treatment for sex partners with the exposure to uncomplicated case of chlamydia and or gonorrhea. It's not designed to replace any current practices, but merely complement the measures that are currently in place. And it's typically not a first-line treatment, but should be routinely offered to sex partners who are eligible for it. Now, the purpose of EPT, as well as a driving factor for this manual, is the national rise in chlamydia and gonorrhea infections. And these two STIs are highly asymptomatic, especially for both men and women. And this creates additional concerns for complications. In terms of men and women, they can suffer from reproductive damage, as well as an increased risk for transmitting HIV. This manual was designed to target providers as they face barriers with effectively utilizing this service. And this comes from their provider perspectives as well as legal concerns. So partner notification services, also known as PNS, is considered the gold standard of partner therapy, and that's merely because it involves a prerequisite medical examination in order to receive treatment, which is kind of the really difference between EPT and PNS. However, it's been shown to be inadequate, especially with one of their primary routes, which is patient referral. It's highly used by providers, but isn't shown to be the most effective method. There are health inequities. Men who have sex with men, African Americans, and adolescents are at a higher risk of chlamydia and gonorrhea. There are failures with the preventative measures for STIs. There is a financial benefit, which is really crucial, as the direct cost of STIs average around billions of dollars a year. And EPT has been shown to really be cost effective in terms of it treats more sex partners at a lower rate. And in most circumstances, EPT is most cost effective. Community relevancy. So the Hawaii Department of Health, they were one of the first states to really initiate chlamydia screenings, especially for younger females. And they continue to evolve in terms of services they offer to try and prevent chlamydia and gonorrhea. And EPT would be a great avenue of expansion for this. There has been a consistent theme in terms of the national rates for those who are at higher risk. And in Hawaii, females around the ages of 15 to 24 are disproportionately impacted. Despite the CDC ranking for Hawaii, chlamydia cases have increased by 20% and gonorrhea cases have nearly doubled. And this manual explicitly discusses how health professionals are really responsible to practicing EPT in a culturally competent manner and emphasizing sexual health literacy. And it's really important because Hawaii is so multicultural. We have 9 prominent ethnicities, as well as we have a higher rate of individuals who are non-English speaking. And it's really important for them to really practice these 2 core elements when using EPT, because it'll strengthen that provider-patient relationship, and it'll improve the sex partner's acceptance, response, and outcome of a treatment. So the implementation process, this process really becomes easier in terms of Hawaii because it's nationally permissible, the service, and it's also, we have a Hawaii EPT law in place, also known as Act 250. And it really eases that integration process because most states, they are permissible, EPT is permissible, but they don't have any laws, policies, guidelines that are in place. And that part really, really makes health professionals less wary of using it because they aren't at risk for any criminal liabilities. Broader implications. So EPT services itself really not forces, but requires health professionals to really learn to adapt and embrace change in terms of clinical practices, because EPT really goes against that gold standard of involving prerequisite medical examination. And it really opens the doors for comprehensive goals for public health professionals as well as health professionals. And really, they both want to improve the well-being and health of individuals. And that's what this service does. And it really changes health professionals on how they decide to go about clinical practices to reach that common goal. And this STI is something that could really be incorporated into EPT as well as other STIs, but this one specifically because it has a simplistic antibiotic oral therapy method that's in place already for men and women, and it is a curable STI, which is really the two main requirements, which is why EPT covers both chlamydia and gonorrhea. It's curable, and it has a simple oral antibiotic therapy that can be administered. So formative evaluation, it was really important to choose an appropriate evaluation method to really gauge the effectiveness of this manual. And it's in 4 stages. We use all 4 stages, and it starts with an interview and ends with a survey of providers and patients. And it really looks at refining the content of the manual to really maximize its success rate, and it maximizes the use of EPT. Thank you for listening, and the rest are just my references.